It is the popular saying that a healthy society is a wealthy one. On the Great Mind program, medical experts are available to provide solutions to various health challenges. You desire greatness in life. Successful men and women in the society are available on the Great Mind program to reveal to you the secrets to their greatness. The Great Mind of Nancy Oshogbo is a watch for all. Meet me on the program every Sunday between 3:30 and 4 p.m. Happy Sunday to you all our viewers at home. This is the day that the Lord has made. I will rejoice and be glad in it. It is another edition of the program, The Great Mind. I am Bola Olayode, your regular anchor on the program. The personality we are celebrating on the program this week is Mrs. Linda Olarewaju, a virtuous woman who was initially maritally challenged before she eventually got married to a man who is God-fearing. Meanwhile, on the segment is sponsored by Osun Health Insurance Agency. Our focus is on the capacity building organized by the agency for the health care providers. Lots of revelations were made at the capacity building. An organization established primarily to providing access for the residents in Osun State, qualitative health care without tears. With the vision of being a world-class health provider, Osun Health Insurance Agency recently presented ICT infrastructure support and health management information tools to accredited healthcare providers in the state to facilitate their optimal performance. It is an established fact that knowledge is power. As Osun Health Insurance Agency presented the facilities to the accredited hospitals, capacity building seminar was simultaneously organized for the healthcare providers to ensure the judicious use of the tools in the interest of the entire people of Osun State. Since Governor Adegboyega Oyètọ́lá makes the well-being of the citizenry his top priority because an healthy society is a wealthy one. Chairman Osun Health Insurance Agency Board of Directors Honorable Adeoye Adelakun urged the participants at the capacity building seminar to strive to train their workers at their various hospitals. The knowledge acquired at the seminar, saying that success without successors is a failure.
But let me start by acknowledging the Governor, State of Osun, in absentia, but he is everywhere here because of his passion for the health of the people and for making sure that this program, Osun Health Insurance, is on course. I want to acknowledge him first and foremost. The Commissioner for Health is not here, but he ought to have been here because he had to really be with the doctor on the talk. So I acknowledge his presence, and I want to acknowledge the presence of the SSC Governor of Health, the OSHA of Health Insurance. Well, my Executive Secretary and the directors in our health institutions of the state, I bid you and all our participants at this lecture, I bid you welcome to this special session. Nobody will deny the fact that ICT has become a part and parcel of our system and the most efficient means of doing things these days. Without ICT, we are not likely to get anywhere fast. And that is where we must introduce it to let us imbibe the efficiency that is required in health facilities all over the place. And also that the paradigm of our health issues is shifting from total free health to health insurance. It is very, very important to do documentation. And anything worth doing at all, they say is worth doing well. I want to just say that we are here to really elevate ourselves and let us know how to actually come into the new normal, because this is what they now call the new normal. It is new, but it's the normal thing that we have to do. And the first step that must be taken is to plan. And anybody that has failed to plan has planned to fail. So I want to now say we want to take this matter, this seminar or this capacity building very serious, because it's going to be the bedrock upon which the success of the health issues in Osun State is going to be based upon.
The Executive Secretary, Osun Health Insurance Agency Board of Directors, Dr. Adeniyi Ogini, who spoke on stages of quality improvement planning in Osun Health Insurance Agency, implored the stakeholders to do everything within their power to ensure the success of the scheme.
In line with the current trend globally in the health sector, the goal of achieving universal health coverage demands that a new strategy must evolve to ensure successful implementation of the health services in such a way as to achieve universal health coverage. And that is what gave birth to social health insurance as a strategy towards achieving universal health coverage. NHIS has gone for so many years and they were not covering lives, and as a result, they came with a policy to the National Council on Health for the decentralization of NHIS, which gave birth to state social health insurance schemes. And that's where we are. The quality improvement aspect of the objective of Health Insurance Agency is one of the things that we are going to talk about today. Quality in terms of human resource for health in the appropriate mix and adequate number. Quality in terms of infrastructure, both ICT infrastructure and other supporting infrastructure in our hospitals, including benches, chairs, tables, and other equipment that we need for our services. Quality improvements in terms of provision of power supply, whether through the mains, the national grid, or through alternative means, including petrol generator, diesel generators, and even inverter, solar inverter, solar panel and inverter. All of these are some of the things that health insurance seeks to ensure happens in all facilities where there is accreditation for services, whether they are private hospitals or government hospitals. And then the third aspect, I've talked about infrastructure, I've talked about quality improvement from human resource dimensions, from infrastructure dimensions. The third one is that of what we call the medicines and supplies. We know that many times they come to our hospital during the care services program, you will write prescriptions for people to go and buy, and they will go and buy them. Under health insurance, you still write prescription for some people to go and buy. But we have come today to let us know what are the prescriptions we can write for people to go and buy. What are the drugs that are covered under the health insurance scheme? What are the ones that are not covered? What are the interventions that are covered under the scheme? So we have come to discuss the technical nitty-gritty of operationalizing state health insurance in our various hospitals. We are all learning to get it right. But it is imperative that we get it right so that we can enjoy our service, the residents of the state can benefit from the program of government, and health system can improve. That is the essence of this gathering. I pray as we go ahead that God will give every one of us the right frame of mind to assimilate what we are being taught, and to think more globally, and we want to talk about globally, not about ourselves, we're thinking about our fellow men and seeing how we can help our fellow men. Because every one of us here, we are in the profession of God. God himself is a healthcare provider. He's a health service giver. And he has brought all of us into the field so that we also can do the same for people. And if we see it from that perspective and we do it well, God is sure to bless us.
Special advisor to the governor on Earth, Mr. Gbenga Oyebode, spoke on attitude, which determines how far one can go in life.
Once we are able to run the exercise we are supposed to run it is more money to you as a worker. There is a legitimate way of incentivizing yourself in insurance money. And so let's just go back. He just mentioned Jalili taking about 4 million naira from them on a monthly basis. If any of our facilities could take 2 million naira on a monthly basis because of your number of your enrollees, you know what each of the staff could have as an incentive. And so let us go back and own this program. Let us go back and begin to work around how this program is going to be successful in our facilities. There's nothing Jalili is doing differently. What is different there is our attitude. And that is the area I am concerned. But on this exercise, for it to work and give the exact result we expect it to give, to be beneficial to us as workers in our facility, our attitude has to change.
Basic Health Care Provision Fund Tax Officer Dr. Ayodeji Akepelu unveiled to the participants at the workshop Osun Health Insurance Agency Benefits Package.
So for your HIV patients that are also coming to us for healthcare insurance, it's not that you just send them away. You give them counseling and also integrate with other programs you have at the facilities. For maternal and child health, for the maternal service now, you give them the routine maternity care. ANC for pregnancies up to 4 live births. The health insurance covers that for 4 live births. After that, they usually take care of all responsibilities. Then, for consultations by skilled healthcare workers, 2 ultrasound. Please let us know this. It is capitated for ANC. First 2 ultrasound. Okay, the urinalysis, screening for malaria for all our pregnant women. It's not that when the pregnant women come, you now write additional tests for them to go and pay. For this, at this level, it is capitated. The screen for urinalysis, malaria, HIV, syphilis, and hepatitis is also there. The PCV check, the blood group, IPT for malaria, that's the prophylaxis or hematinics, and also healthcare education. For the maternity services now, for the primary care now, sorry, for the secondary care, once you are not attending at primary care, we expect you to go through the process of referral. That's where you generate your code. Without that authorization code, that patient's secondary care. So at this level, it is very, very important to generate that code from your HMOs to access the secondary care. For the secondary care now, consultation with a specialist. We expect that at that level. Then delivery of multiple gestation and other high-risk pregnancies, such as malpositioning and other management of hypertension in pregnancy, management of gestational diabetes, management of preterm labor, management of preterm labor, PBH, management of IUFD, intrauterine fetal death, and management for ectopic pregnancy. At this level, for the maternal services for the secondary care, it is all covered. There we expect you to generate a code. Removal of placenta and repair and prevention for maternal to child transfer services. We expect you at the primary care for the primary services, which is all capitated. We expect all these services at that level. For the secondary care, like forceps delivery, forceps and vacuum delivery, cesarean section also covers for 4 live births. It can be elective, emergency, or twin, as long as you're going for a CS. At the second level, it is covered.
Director Standard Quality Assurance Osun Health Insurance Agency, Dr. Shina Igbalaye, gave the talk on claims management, referral mechanism, and operational challenges.
We need to take advantage of what we have. So, I also get into operational challenges because we have so many complaints which are actually chronic. And I will be presenting that to the various complaints that they are having. By the time they come to our hospital, some of our staff will not attend to them well. Discourteous treatment, ìṣògùn ilé ìtòsí doctor, wọ́n ti kọ́kọ́rọ́ lọ, wọ́n ti tilẹ̀kùn pharmacy and all sorts of things. And these are things that the private hospital we do not encounter such complaints from private hospital. They have their own demerits. I must tell you, they have their own complaints too. But as I have said, I wish we could have this, the money from the capitation part from us, the civil servants, coming to government hospitals where we are joining our salary instead of going to private hospitals like Aleni. Today, I must tell you that every of the major projects going on at Aleni is funded by Holy money. In fact, now they are extending their work, they are extending their data, they are doing sort of thing. By the time the best of service, end of the day, and they are using that to prosecute their system, to do all of the things that they are doing. So please, I want to implore us that, and that is why we have promised to do this from time to time. We know we cannot get it overnight. We also not rest on our words. Let us try to build the capacity so that.
As the Executive Secretary of Osun Health Insurance Agency, Dr. Adeniyi Ogini responded to the observations made by the healthcare providers at the capacity building seminar. He gave them the assurance on the removal of bottleneck that hindrances performance. To give room for efficiency, details of this will be given in the subsequent edition of the program. As I said earlier, on the personality segment this week, the personality we are celebrating on the program is Mrs. Linda Olarewaju, a virtuous woman full of experience. She has been using her experience in life to educate people how to make success of their marriage. Mrs. Linda Olarewaju Michael was born in Ondo State in 1962, but grew up in the north, as she lost her mother shortly after her elementary education. Although she lost her mother when she was between the age of 11 and 12, yet her mother succeeded in inculcating in her a strong faith in the Supreme Being.
When I was born in 1962, Ifon in Ondo State, even though I didn't grow up there, 8 days after my birth, I was taken to Jos by my mother, so I grew up in the north until after the war, the civil war, came back home. I did my primary school at home, St. Paul's Anglican School in Ifon. And when I finished, I lost my mom immediately. I finished my primary school. And since I didn't live with my father, because my mother didn't live with my father. So, and my brother took me up. And let's say from there, even though I had a good youth with my mom because she inculcated every Christian principles into me, I watched her grow as a Christian should grow. I watched her pray. I saw the power of God operated through her life. And I think that has helped me when I lost her. It helped me, though I felt her absence.
The death of her mother really exposed her to the assaults of life.
And then I now have to live with my elder brother. From there I went to secondary school in the Ime Girls Grammar School, Imeora. That's in Edo State. I finished from there. I got admission through the old Tedru to Ahmadu Bello University Teaching Hospital. I did my nursing there and my midwifery, and that time it was a government scholarship, so I got a government scholarship. I was trained by the government, and by the grace of God, when I finished, I was automatically absorbed by the institution. And I worked with the institution for 6 years. But something happened along the line, and it's a sad experience that actually, when I think over it, I don't want to remember.
Mrs. Linda Olarewaju Michael is a medical professional by training. Mrs. Olarewaju had heart-rending stories about her marital life before she eventually met her husband, Pastor Michael Olarewaju, the outgoing senior pastor of the Living Faith Church, Osogbo. She described her husband as a comfort package from God.
Having somebody, you have somebody to get married to, but along the line, you happen to find out that the person is not what he claims to be. And I say I went through some tough time. I almost lost my life. But God delivered me. I'll say God did. And I had to leave my work. I had to resign, even though I was begged not to. My institution begged me not to. But I felt leaving the environment. That was in Zaria. We met in Zaria. Will help me to forget. So I had to relocate back home. And I stayed for 6 months. I was with my brother until I relocated to Abuja. I believe it was a direction, it was God's direction, because I went to drop his children in the military school just when I met an old minister friend. And then from there, my wife, I've been asking after you, let's go and see my wife. I just happened to stay there. And there's something I want to make known to parents and to daughters in the family. That whatever your mother went through, if you don't pray against it, especially negative, you will carry it. It's a generational lineage that cannot be broken. And I remember that was exactly what my mom went through. Even though after she gave birth to me, she said she was not going to get married again. I'm not the same father with my brother. We are different. And I came home and I was like, God, I have served you with my youth. Why do you allow this to happen to me? Because after that 6 months, I relocated to Abuja, headed the hospital, and God helped me. God helped me. I worked 7 years there before I met my present husband, and we got married.
How did you meet him?
Well, I was in another ministry actually, but that 95, I had a leading to go for Ruby in Living Faith Winners Chapel. So I took the form, I went, and he happened to be one of my lecturers, but it's not like somebody I actually would go for, because he was too quiet, and I don't like quiet men. I don't really like quiet men. But somehow along the line, when he made the approach, I wasn't interested. Funny enough, the day I came to my senior pastor's office, he was very close to the senior pastor, and I think he brought a report. So immediately I saw his leg, I just pulled my hat over my face so that I wouldn't know I was the one. And inside of me, I was telling God, please don't direct his step towards this place. Unfortunately, when he finished, he just came straight to me and said, sister, I'll be waiting for you. And I was very angry. Very angry. I said, but I told you not to. What? I said, anyway, I went. He said, what about what I told you? I said, I'm still praying. Truth, I wasn't doing any prayer. I was not just interested. until God came, and I was telling God, God said, the person that used to talk, that your life almost went, say you have started again. That was it. Say you have started again, Abi. That was after 7 years of release separation. For 7 years, I stayed without a relationship. And you can count that with my age. So when he said you have started again, and then one day I was in a church service, Sunday service like that, and he was sitting down, and God turned my face, and I looked, and it changed. The glory changed on his face, and I heard the voice say, "There's a husband material in you." I said, God, me, I don't like him. But if you know you are the one, just let me like him. And that was all. And God just put his love in my heart. And if you ask him, I never said yes, but now we are married over a decade. I never said yes, I will marry you. But and I saw him as a comfort package from God. So I thank God I married him. You know, because he's a man of understanding. You understand? He may not talk, but he understands. That is what every man needs to keep a woman. Why? Because in a home, two people are coming together from different experiences and backgrounds. And if you insist on your own side of experience to live with your partner, the marriage will not work. We must come to a place of compromise. That's what covenant is all about, and that is what he has done. You know, I'm a woman given to temper, and I can flare up easily. God is helping me now. But those days when the rage comes, he will just look at me and say, my, and smile. I will be more angry. Say, he's not even looking at me that I'm angry. You know, but after some time, the person you are fighting with doesn't even know you are fighting with. So, are you not the stupid one? Why no melody? You understand? And along the line, we have been able to help each other, repair each other. This one, you leave this one, and then I take from him, he took from me, and we have been going along.
Since her marriage to Pastor Michael Olarewaju, she has been a dynamic and vibrant minister of the gospel of the Lord Jesus Christ. She is a teacher by divine placement, counselor, good wife, and good mother. Mrs. Linda Olarewaju Michael has ministered alongside her husband both within and outside the country in churches, Bible institutes, seminars, and fellowships under God's grace with testimonies. Her husband of more than a decade has this comment about her.
First, I saw in her a woman that loves God, her passion for the things of God. In fact, our first contact, or what actually connected us together, was her committed to service. So that attracted me to her.
On that note, you are heading this week edition of the program. Next Sunday is another date. God willing, again, stay blessed.